Hello and welcome everyone. So I'm going to do a video here to really help address and answer some questions that I have had over the years, and this video should really give you some more insight. So basically, this is a brand new article. This is titled Flawed Herpes Testing Leads to Many False Positives and Needless Suffering. And this was done January 26, 2017. And this was done by statnews.com. I'll include the link below this video in the About section so you can take a look at this. So obviously they're going to show herpes here, and they're going to show some information. Now, getting into this particular person, I'll kind of summarize it because I'm going to briefly go through this, and all of you will be able to read it, and then I'm going to give some answers to unanswered questions, which I would do here very shortly. So at this point, there was a person, her name was Lauren, and she did a test, and it came back positive. 6 months later, she talked to family members, forums, everyone else in Western medicine, or that knows about Western medicine, and she ended up doing another test and having it come back negative. Now, if you watch my other videos, I've always mentioned to go to the same testing facility and do the antibodies test. Why do you think that is? Because there's a lot of false positives. And I'm going to show you this right here. It shows up to 1 in 2 positive tests, right here, could be false. And this is according to this particular guideline. Based on their guidelines. So this is coming from people that know about Western medicine telling you that this is a failure. That high failure rate isn't, however, always communicated to patients, and then it goes to explain a lot of doctors won't do these tests without having a conversation, and then it says, but no data exists on herpes screening rates according to the lead author of the CDC's STD treatment guidelines. So it's difficult to know how many people could be living with a misdiagnosis. Very interesting, isn't it, folks? You get a positive test, and you go ahead and do that test, and let's just go ahead and show everyone which one that was, so you know it was the IgM test. Alright? So don't do that test. It's obviously completely bogus, and so are many other tests for Western medicine. Blood tests people think are accurate because they draw your blood and they are doing some scientific test. They must be accurate, right? No, unfortunately not. And, Western blot right now is the gold standard test for herpes, okay? So there are other antibodies tests, but this is, again, what I'm telling people. They change names all the time, but you need an antibodies test. And the problem with this is that the University of Washington will provide these tests to patients across the country. A practice it began over a decade ago, when it realized the more common tests were prone to false positives. But when you look at this, it's saying that a low positive of antibodies to HSV2, the cutoff for a positive result on the Herpes Select test manufactured by this particular company, 2005 study, they showed that the values above 3.5 yielded over a 90% accuracy. But what about the scores between 1.1 and 3.5? They only had about a 50% chance of being wrong. So when you're looking at this, scores falling just above the 1.1 had almost 90% chance of being wrong. So what does this mean, folks? It means you got to go to the same place. You got to do 2 tests. And I mentioned this in other videos. And you really need to make sure that you're doing this the right way. These are indications, folks. If you come back negative, and you did this twice, and you aren't having outbreaks, and you are still eating somewhat of a plant-based diet, but you're back to your normal life, and you're not getting outbreaks, then you're obviously fine. But if you continue to have sexual relations with people and doing promiscuous ways, could you get this again? Absolutely, just like anything else. Then you would have to detox and get rid of this again. It should be easier the second time. However, if you're not having symptoms, your chances of passing something to somebody are virtually almost zero. I wouldn't say at zero, but I would say almost. Because you could get pretty much anything by having a poor diet today. And you can reinfect with this particular issue always again, just like anything else. If you get rid of heart disease, can you get heart disease again? Of course. If you have cancer, can you get cancer again? Of course. If you have from an acidic body to an alkaline body, can you go back to being acidic? Of course. So you need to keep this in mind, folks. Balance out your diet and, take precautionary measures and move on with your life. It's very simple. So, and this brings me to the next part. Syphilis and gonorrhea rates have risen sharply in the U.S., the CDC says. So, I'm not going to go over all of this, but I really want to show you the important part that herpes tests aren't the only ones with a risk of false positive. False positives can occur for any test that diagnoses viral infection. Look at that. Based on antibodies. Your human body's reaction. Rather than direct detection of the virus. So this means, could you have a false positive? Of course. Could you have a false negative? Yes, that is true. It's much harder to get 2 in a row, or especially 3 in a row, than it is just 1. It's much harder to get a false positive from a negative if you went to the same testing facility, went to the same place. If you go to different places, absolutely. You're most likely going to get a negative then to a positive, or a positive to a negative, or vice versa, or again get a positive then a negative. You're going all over the place. Keep it at one place. Use a plant-based diet. Watch my other videos. I really have put videos up. How to get gets rid of heavy metals, barley grass, spirulina, chlorella. Couple with the chlorella and the spirulina. When you couple those together, you're going to remove metals quicker. Again, plant-based diet. If your body is acidic, you want to obviously use berries. You can use melons. You can use even grapes. You want to coordinate that, even if you use it, especially with the antioxidant powders, which are other powerful fruits. Watch my video starting from September 2015 all the way to December 2015. Show all the antioxidant powders. Again, I showed a few of those in the recent videos. You need to use these. You can even use the medicinal mushrooms to really help get your kidney to start filtering, and your liver to really, if it was sluggish, to start moving again, along with organic milk thistle. All of these things are very important, folks. You got to take the initiative and move forward. You can do all the tests you want. You can listen to the medical community all you want, but that's one system. It's a business. They're great at drugs, surgery, and keeping lifetime customers. But if you want to get better, you need to do this on your own, and you need to be smart and wise, and you need to go to the same testing facility. Tests are just an indication. They're a guide. But again, if you're testing negative, obviously that's an indication that you're on the right path and you're doing it right, and then just move forward from there. Any questions, folks, go ahead and let me know. But I hope this can address a lot of your questions and concerns out there. But you really need to look for the new antibodies test. They change. Always look for the antibodies, because that's going to be your best way. Thank you. Bye-bye.